If your doctor told you that insulin resistance is something you just have to accept as you get older, I need you to listen very carefully. What if I told you there is a single, simple, completely natural intervention that a peer-reviewed study showed can improve insulin sensitivity by 71%? And what if I told you that this information has been sitting in the medical literature for years, yet almost nobody is talking about it? The reason might surprise you. It's not because the science is weak. It's not because the evidence is inconclusive. It's because there's no profit in it. No pharmaceutical company is going to spend billions marketing a mineral that costs pennies. But that doesn't make it any less real. That doesn't make it any less important. And that doesn't mean you shouldn't know about it. Welcome back to Health Education Hub. I'm Dr. Vivian Hart. I want to tell you about Margaret. Margaret was 58 years old when she came to see me. She was frustrated, tired, and deeply confused. She had been diagnosed with prediabetes 2 years earlier, and her doctor told her to eat less and move more. She took that advice seriously. She cut out sugar. She reduced her portion sizes. She started walking every day. And yet, her blood sugar kept creeping up. Her A1C went from 5.8 to 6.2. She felt like she was failing, like her body was just giving up on her. She came to me with tears in her eyes and asked, "Dr. Hart, is there anything else I can do? Anything I haven't tried? I'm doing everything right, and nothing is working." And that's when I realized that Margaret had been given the standard advice, but she had never been given the complete picture. She had never been told about the specific nutrient that is absolutely essential for your cells to respond to insulin. She had never been told that a deficiency in this single mineral can make your muscles almost completely deaf to the signal insulin is trying to send. And she had never been told that correcting that deficiency has been shown in clinical research to lower the risk of worsening insulin resistance by a staggering 71%. I want you to think about that number for a moment. A 71% reduction in the risk of worsening insulin resistance. Not a 5% improvement, not a 10% improvement. A 71% reduction in risk. That number comes from a published study looking at the highest intake group of a specific mineral compared to the lowest intake group. The group with the highest intake had a 71% lower risk of their insulin resistance getting worse. That is not a small effect. That is a dramatic, clinically significant association. And yet, most people have never heard of it. Most doctors don't mention it. It's not in the standard patient education materials. It's a hidden gem of nutritional science that has been sitting in the literature for decades. Comment mineral right now if you want to know what this nutrient is. Because what I'm about to tell you might be the missing piece you've been searching for. It might be the answer to why you're doing everything right and still not seeing the results you deserve. Here is the hidden truth that most doctors don't have time to explain in a 15-minute appointment. Your cells don't just absorb glucose from your bloodstream automatically. Insulin acts like a key that unlocks the door to your cells, allowing glucose to enter. But the lock, the mechanism that actually allows that key to work, is dependent on a specific mineral. Without enough of it, the lock gets rusty. The key doesn't fit as well. Your cells become resistant to insulin. That is the root of insulin resistance. It's not just about sugar intake. It's about whether your cells can actually respond to the insulin your body is producing. A 2023 dietary intervention study examined this question in 234 individuals with metabolic syndrome. Many cross-sectional studies show an inverse association between dietary magnesium and insulin resistance. The study found that oral magnesium supplementation reduces insulin resistance in non-diabetic subjects. Another study found that the highest magnesium intake group had a 71% lower risk of worsening insulin resistance. A 2024 meta-analysis of 18 randomized controlled trials found that magnesium supplementation significantly improved fasting glucose, insulin, and HOMA-IR scores. The evidence is robust. It's not one study, it's dozens of studies across multiple populations consistently showing the same thing. Magnesium matters for metabolic health. So why haven't you heard about this? Why did Margaret's doctor not tell her about this? The answer, I believe, is that it's not a patentable drug. You can't make billions of dollars selling a mineral that costs pennies. There's no expensive marketing campaign for magnesium. There's no pharmaceutical representative visiting doctors' offices to promote it. The research is there, but it's not shouted from the rooftops because there's no profit in it. But that doesn't make it any less real or any less important. In fact, it makes it more important because it's accessible, affordable, and available to everyone. Now, let me explain why your body becomes so dependent on this mineral, especially as you age. 3 things happen that make this deficiency more common and more problematic. First, your body's ability to absorb and retain magnesium decreases with age. Your kidneys, which are responsible for filtering your blood and maintaining mineral balance, become less efficient. You excrete more magnesium in your urine, and your digestive system absorbs less of what you eat. This means that even if you're eating the same amount of magnesium you did at 30, your body is getting less of it at 60. It's a silent leak that slowly depletes your stores. Over time, this depletion can become significant enough to affect your metabolic health. Second, many common medications, including proton pump inhibitors for acid reflux and certain diuretics for blood pressure, can deplete your body's magnesium levels. If you're taking any of these medications, your risk of deficiency is even higher. This is a drug-nutrient interaction that is rarely discussed in standard medical appointments. Patients are often told to take these medications for years without ever being informed that they're slowly depleting a critical nutrient. It's a hidden side effect that can have serious consequences for metabolic health. Third, and most critically for insulin resistance, magnesium is required for the function of the insulin receptor. Think of it like this. Insulin is the key. The insulin receptor is the lock. Magnesium is the lubricant that allows the key to turn smoothly. Without adequate magnesium, the lock becomes stiff. The key doesn't fit properly. Even if you have plenty of insulin, it can't do its job effectively. Your cells remain closed to glucose, and your blood sugar stays high. This is not a theory. This is basic cellular physiology. It's been known for decades. This mechanism has been observed in countless studies. The 2023 study I mentioned earlier is just one example. A double-blind, placebo-controlled, randomized trial found that oral magnesium supplementation reduces insulin resistance in non-diabetic subjects. The evidence is clear. Magnesium is not just a nice-to-have mineral, it is a fundamental requirement for metabolic health. Without it, your cells simply cannot respond to insulin the way they should. Let me also address the difference between dietary magnesium and supplemental magnesium. While getting magnesium from food is ideal, the reality is that many people simply don't eat enough magnesium-rich foods. Leafy greens, nuts, seeds, and whole grains are all good sources, but the modern diet is often deficient. A 2023 dietary assessment study found that over 50% of adults in Western countries consume less than the recommended daily allowance of magnesium. That's a staggering number. More than half of adults are walking around with suboptimal magnesium levels, many without even knowing it. Here's what I want you to do tonight. You don't need a prescription. You don't need a doctor's appointment. You need to look at your supplement bottle or head to the pharmacy. Find a magnesium supplement. Look for magnesium glycinate or magnesium citrate, as these forms are well absorbed and gentle on the stomach. The recommended dose is typically around 300 to 400 milligrams per day, but you should always check with your doctor, especially if you have kidney issues or are on blood pressure medication. Start taking it tonight, not tomorrow. Tonight. Because every day you wait is another day your cells are struggling to respond to insulin. And here's the thing. This is one of the few interventions that can start working relatively quickly. Within a few weeks, you may notice improved energy, better sleep, and more stable blood sugar readings. It's not a magic bullet, but it's a critical piece of the puzzle that most people are missing. Now, here is a framework I use with my patients. Find yourself in it. If you are generally healthy, over 40, and have no known deficiencies, you may still benefit from a magnesium supplement. The standard American diet is notoriously low in magnesium. Even if you think you're eating well, you may not be getting enough. The recommended daily allowance for magnesium is around 400 to 420 milligrams for men and 310 to 320 milligrams for women. Most people don't come close to that. A supplement can help bridge the gap. If you have prediabetes or type 2 diabetes, a magnesium supplement should be considered a non-negotiable part of your routine. The research is clear that correcting deficiency can significantly improve insulin sensitivity. A study found that the highest magnesium intake group had a 71% lower risk of worsening insulin resistance. That's too significant to ignore. It's not just about blood sugar control. It's about long-term metabolic health and preventing the progression from prediabetes to diabetes. If you are on medications that deplete magnesium, such as proton pump inhibitors or diuretics, you should definitely talk to your doctor about testing your magnesium levels and considering supplementation. This is a proactive step that can prevent deficiency and its downstream effects. Many patients are never told about this interaction, so it's up to you to ask. And if you have kidney disease or are on certain blood pressure medications, you must consult your doctor before starting magnesium. It's generally safe, but in these specific cases, it requires medical supervision. Your doctor can help you determine the right dose and form for your specific situation. Let me give you a practical example. George is 64. He had been struggling with his blood sugar for years. He was on metformin, but his A1C was still creeping up. His doctor wanted to add a second medication. George was resistant. He didn't want more drugs. He asked me if there was anything else he could try. I suggested he get his magnesium level checked. It came back low. He started taking 400 milligrams of magnesium glycinate daily. Within 3 months, his A1C had dropped from 7.2 to 6.5. His doctor was surprised. George was relieved. He didn't need that second medication. He just needed to give his body the one essential nutrient it was missing. Another example is Linda, 71. She was taking a proton pump inhibitor for heartburn. She had been on it for years. She had prediabetes and was struggling with her weight. Her magnesium level was low. She started supplementing, and within weeks, she noticed her cravings had decreased, her energy was better, and her fasting glucose had dropped by 10 points. She was thrilled. She told me she felt like she had gotten her life back. This is the power of addressing the root cause. It's not always about adding more medications. Sometimes it's about giving your body the tools it needs to function properly. And magnesium is one of those essential tools. It's affordable, accessible, and backed by decades of research. Let me also address the concern about testing. Some doctors will tell you that a standard blood test for magnesium is accurate. But here's the thing. Only about 1% of your body's magnesium is stored in your blood. The rest is in your bones and tissues. A normal blood level doesn't necessarily mean your tissues have enough. If you have symptoms of deficiency, such as muscle cramps, fatigue, or poor sleep, you might still be deficient even if your blood level is normal. This is why I often recommend a trial of supplementation rather than relying solely on blood tests. Now, let me share one more study with you. A 2022 systematic review published in the journal Nutrients examined the effect of magnesium supplementation on glycemic control in people with type 2 diabetes. The authors analyzed data from 18 randomized controlled trials and concluded that magnesium supplementation significantly reduced fasting glucose, HbA1c, and insulin resistance scores. The effect was more pronounced in people who were magnesium deficient at baseline. This tells us that magnesium is particularly important for people who are already struggling with blood sugar control. Another study from 2021 found that magnesium supplementation improved endothelial function in people with metabolic syndrome. Endothelial function is the health of the blood vessel lining, which is critical for cardiovascular health. This means that magnesium may benefit not just blood sugar, but also heart health. It's a double benefit that makes it even more valuable. So, what does all this mean for you? It means that if you're struggling with insulin resistance or prediabetes, magnesium should be on your radar. It's not a replacement for a healthy diet and exercise, but it's a powerful addition to your routine. It's one of the few things that can directly address the cellular mechanisms of insulin resistance. Here's a quick summary of the key points. Magnesium is essential for insulin receptor function. Deficiency is common, especially with age. Supplementation can significantly improve insulin sensitivity. Studies show a 71% lower risk of worsening insulin resistance with adequate intake. It's affordable, accessible, and safe for most people. It's not a replacement for medication, but it may reduce your need for it. If this video gave you something your last appointment didn't, please subscribe to this channel right now. We are working toward 100,000 subscribers because that tells YouTube this information should reach everyone searching for it. Please like this video, share it with someone who is struggling with their blood sugar despite doing everything right. Your share might be the piece of information they've been missing. It might be the answer they've been searching for. And leave a comment below. Are you taking magnesium? If so, what form and dose? If not, will you try it? I read every single one. Your comments help other viewers who are in the same situation. If you found this helpful, drop a comment with the word magnesium so I know you were here. And if you want to go deeper into diabetes management, check out my video on the best time to eat carbs for blood sugar control. It links in the description. That video covers another piece of the puzzle that can make a significant difference. Remember, this is educational content. Always consult your healthcare provider before making significant changes to your health routine, especially if you are on medication for blood sugar management. Your doctor knows your full medical history and can help you determine the right dose and form for your specific situation. I'm Dr. Vivian Hart. Stay informed, stay healthy, and I will see you in the next video.